When dealing with children in the pediatric ICU, there are some special concerns, special issues that have to be taken into consideration. Children are different. They are not just small adults. They have a different pathophysiology, a different anatomy. And those are the aspects that we intend to cover in this particular talk. The objectives of this talk would be to understand differences in physiology of infants, children and adults, to learn effect of these differences on management of critically ill children, and take some specific critical care concerns in children. Now, critically ill children present somewhat differently. When adults have a problem, they are able to communicate, they have many ways of showing to the doctor as to what is happening, whether it's symptoms, whether it's description of their problems, or even the signs that are there. While in pediatric age group, these are all very limited. Children just cry. That's the commonest problem or the commonest symptom with which they would come to us. And this is an inconsolable cry. When the child can be consoled easily, probably is not that critically ill. Yes, children look sick, and this sick look is a kind of qualitative way of looking at the child. It's something that comes with experience. You can see the child and make out, yes, this is a sick child. Then they may be refusing to feed well, or feed completely, not to feed at all. They may have breathing disturbances, or there may be respiratory distress, subcostal, suprasternal, sternal recessions. Infants' whole sternum may be getting sucked in with each breath, indicating a respiratory tract obstruction. They may be just lethargic or even totally comatose. All these are common manifestations of a comparatively sick child. The approach to a child who walks into the, let's say, the ER, the emergency room, and you have to take a first look. At the first look itself, even before you touch the child, there are some indicators which can guide you as to how quickly you should be looking after this one in preference to the others who may be already waiting. If you look at the appearance of the child and child appears very anxious or worse, lethargic, comatose, obviously this is somebody who needs immediate attention. The second arm of this triangle that is shown on the diagram there is that look at the work of breathing. You are just looking at the child. You don't have to even touch.